Welcome this morning or this afternoon. I'm Gini Stimpson, and I'm here as the chair of the Low Vision Hearing Challenge Committee. And last month in the UW Alumni Magazine, it talked about the work that Dr. Yi Shen is doing at the Speech and Hearing Clinic at the UW. And he gave a talk to the Alumni Association. So I immediately wrote to him and I said, you wouldn't want to come to Horizon House and do this, would you? And he said yes right away. Isn't that terrific that he would make the time to come? So I was telling him some of the things, the messages that we give from our committee, and he said, maybe you could give my speech for me. But believe me, I know this from hearing things, and he knows it because he investigates, and this is his practice. But he not only said he would come today, but he agreed to come back on May 19th at 1 p.m. And on that day, he's going to bring some of the over-the-counter hearing devices with him so that people can try them out. We're going to be in small groups, small table groups, where people will get to work with individual UW students to try out these devices, and if people need their hearing tested, that can happen that day too. So, whoa, we got a, not only did we get graciousness immediately, but we got a bonus package with that. There'll be an announcement that's in the alert about it, but you could go after this program to see Jess, because we only have 21 spots that day for people to try out the devices or to get their hearing tested. And then I said to him, but I bet we have more people than that want to. And he said, we could come back again. Whew, okay. This is just music to our ears. So thank you for your graciousness in coming. And we're excited to learn from you. And and I was telling him how to use the microphone. He says, Ginny, I'm in hearing. I know how to use the microphone. So, thank you.
All right. It's my pleasure to be here, meet people, new faces, and I like to go around and meet people and talk to people about hearing. That's kind of what I do. And then whenever people reach out to me, like, do you want to come to our community and talk about hearing? I was like, I've been waiting for this so long. So I want to do this, not only because this is what I do, I'm in this field, because as we're gonna learn today, that we are such a small field, a research field, and field of practice, and face a very big public health issue, which is hearing, which impact practically every single person. So that's where we're gonna start talking about. So today we're gonna walk you through why we care about hearing. So hearing is just not just hearing, but impact more healthy aging. But then we'll also gonna talk about, does hearing aid play any role in mitigate some of these difficulties? And then we'll talk about the rationale behind over-the-counter hearing aid, why it's get created, and what are the devices on the market. And then lastly, we'll talk about how do we know that these devices over-the-counter will help, could be helpful, and what are some of the limitations of the current OTC device. Okay, so age-related hearing loss is a highly prevalent health issue. How do we know? We know that above the age of 70, we're talking about 2/3 of people are living with very degree of hearing loss. We're talking about practically every single person. It's about at different stage where everybody is on a different trajectory and timetable, but we are going to live with the age-related hearing loss at some point. So then, treating hearing loss as a disease and using just the kind of medical model and like overseen by licensed professionals, especially the field of audiology is very small, is not adequate to serve such a big problem. So we begin to rethink how we deliver service to the broadest range of people through a public health approach, where we call wellness approach. So hence the title of today is Auditory Wellness, not hearing loss, not some kind of disorder, hearing disorder. We're not thinking of this as a disorder. We're thinking about the wellness and well-being. So that's what we're talking about. So let's be nerdy for a second about how this trajectory works. So if we're talking about the percentage of people have age-related clinical significant age-related hearing loss, so this is a proportion for people between 71, 74, 75 through 79, and so on and so forth. So you can see that the prevalence go up as the age group get older, and men tend to have earlier onset of age-related hearing loss. So that's the status of age-related hearing loss. But we know age-related hearing loss is not just sensory health. It's not just hearing or speech understanding. Yes, speech understanding is very important part of life, and it's very important. But the more we think about the impact, it's actually broader. So we know that age-related hearing loss is associated, if leave them untreated, it's associated with heightened risk of social isolation, depression, dementia, risk of falling and injury. So we tend to think of these conditions, such as age-related hearing loss, using this World Health Organization's well-being model, that whether you can understand words people are saying, is really just talking about sensory and body functions, not capturing these other things, the limitations to activities that you can do, and whether this condition create restrictions to participation in employment, studies, and travel. So we want to think this broadly. The current practice, so the current practice of audiology focus on sensory health, address hearing loss, make sound audible. So that's a very limited lens. So that is not adequate to address this broader impact. So it attract even more attention when we realize the tie between hearing loss, age-related hearing loss, and the risk of dementia. So this is an infographic. I know the words are small, but so this graph summarizes all the factors that potentially predict the risk of dementia, contributing factors. So the gray bar is unknown cause. There's a part of this cause of dementia is still mystery. We do not know or modifiable. However, the colored ones are the causes or the risk factors that we do know, and many of them are modifiable. We have the control of. And the bigger the circle of individual circles, the bigger the contribution. So I'm going to read you some of the bigger ones. So smoking is no good. Hopefully people know. However, this big circle here, counting for 9% of contributing 9% of risk of dementia is hearing loss. So, which is almost the biggest circle around here. Okay, so that's really attract a lot of attention because to the federal government in particular, because they think, okay, addressing hearing loss versus addressing dementia, they know which one is more cheaper and effective, right? So, so hence they invested a lot into the investigation between this tie between hearing loss and dementia. This chart, if you think, oh, this is just one study from the United States, it may not capture everywhere else. Well, this particular study has been replicated in almost every single continent. So this is basically the chart I'm going to read you. The left one is from Australia. This one is from Latin America. The blue one is from India. The green one is from China. Oh yeah, so the circles list all the risk factors. So some of the ones that are listed here is lower education level, hearing loss, obesity, hypertension, alcohol consumption, physical inactivity, depression, diabetes, pollution, smoking, so on and so forth. So you can see that many of these factors are talking about a general health issue. Yeah. Yeah, I understand. So they are their comorbidities, right? So, but nevertheless, unless these things are tied together. So that's what this data is showing. So in terms of address that causal relationship, really what people ought to do is that give people hearing aids to address hearing loss issue to see whether that will delay or slow a cognitive decline, right? So that's exactly what people did, what the federal government funded a study did. So this study, well, there are many studies, but this one led by Johns Hopkins is probably the more comprehensive one. So what they did, this is called ACHIEVE study. So they give hearing aid to two cohort of older adults for a period of 3 years. They, track their progress along the way at different time points. So that's 3 years. At the end of 3 years, they assess the outcome to see whether it makes any difference. So, long story short, well, if we want to, this is a summary of their findings. The line, the vertical line here suggests, indicate no effect. So 0 indicate no effect. So if these dots are on the right significantly, so that indicate benefit. So if it's on the left, unfortunately, that means harm. So hopefully we don't want to do harm. So they have two cohort of individuals enrolled in this study. So there's first group, an ongoing longitudinal study on cardiovascular health. So this group were further recruited into this hearing aid study versus the second group, which is at the bottom here, that's newly recruited from general aging population. So what we learned from this study after 3 years, that was just concluded not very long ago, was that when we recruit individuals from the general public, we do not see a significant effect of hearing aid use. However, when we give hearing aids to people who are already at higher risk of dementia, with these people enrolled in a cardiovascular health trial and study, so they already at a higher risk. So these individuals could potentially benefit from hearing aid more. So that's a subtle, but at least an evidence indicating benefit of hearing aid use. This is one study across multiple studies that completed so far. So this is a summary. So each of the study with different number of sample size, different number of participants in them. In this case, vertical line here indicate no effect. Dots or symbols on the left indicate benefit. So generally speaking, we either find no effect or benefit. Is that impressive? It is not so impressive because slow down cognitive decline is not something like a magical switch. But nevertheless, emerging evidence starts to show the benefit of addressing hearing loss. So, and of course, goes without saying, taking care of your hearing will address your hearing needs immediately, right? What we're talking about is the benefit from hearing aid to cognitive health. So we begin to see emerging evidence for use of hearing aid. With these benefits, we are still seeing the reality of hearing aid uptake being lower than we want to see. Among all the people who could benefit from hearing aid, we know only a small fraction of people actually use them. With people who use hearing aid, from the time their hearing loss get diagnosed to the purchase of hearing aid, there's on average of 6 to 7 years of waiting. So the reason is complex, but people have searched and trying to address those reasons. So some of the reasons, if I try to read it for you, are I don't think my hearing was so bad. That's the top reason. Cost, which I circled here, and then not having insurance coverage, and then not sure who goes for care. This is talking about accessibility. Fear of looking old. So this is talking about stigma. And then lack of access of professional help, misinformation. So you can see this list of reasons address a variety of issues. But if we were to, from a policy making perspective, from the government perspective, how do we address? So what they come up is that they figure out there's two things we can address from policy making perspective. One is address the accessibility. So this is a distribution of audiologists in the United States. You see there's like a big area of the country have no audiologists at all. So going to an audiologist for many people means driving for hours just to get their hearing aid fixed. For people who live in rural Alaska, we know they have to fly. So this is the distribution of pharmacists. So we know that we do not have a good support system to promote hearing care. This is too big of a problem, like what I was saying at the beginning. Too big of a problem to too small of a field. So that's accessibility. Second is affordability. So hearing aids are expensive. Many times it's out-of-pocket expensive. Many devices, a pair of hearing aids could cost like $5,000. One thing that I've heard people saying is that for many families, the biggest out-of-pocket thing that they paid for or they own is their car. The second is their hearing aid. And this is clearly not adequate to, if we're thinking of this as a public health problem, we're trying to help every single one, and this is clearly not adequate. So after going through these studies and evidence, the decision was the government and the president, Obama at the time, requested the FDA to create a new category of over-the-counter hearing aids, in the hope to reduce the barrier of getting hearing aids and reduce the cost. And you may ask, why don't we just make hearing aid openly available without FDA regulation? Well, you will have FDA will ensure these devices are safe and effective. If you don't have any oversee by the FDA, then this would be, you could imagine there could be very many bad players enter into the market. So this is a careful process. FDA took their time from 2017 through 2022 and a lot of the time spent between those 3 years was about safety and effectiveness, right? So hearing professionals, even though there are not many of them, but they worry that when you open up the hearing aid over the counter, will they work? Would people find it, helpful? Would people harm themselves with these devices, right? Would bad players enter into the market and try to take advantage of people? So there are many reasonable debates underneath this final ruling, which came out August of 2022. So we're more than 3 years since the first OTC hearing aids are on the market. The market is still maturing and emerging with its own problems, which I will talk about. Okay. So the timeline here to the right, so 2022, that's when the hearing aids are on the market, OTC hearing aids. With the availability of over-the-counter hearing aids, now that we have different classes of devices, when you are going into a store or going onto a online vendor like Amazon and search for hearing devices or hearing aids, there are this long list of devices, range from $20 to $2,000. They all look exactly like hearing aids. So it created a little bit of confusion, to say the least. Let me just break it down for you how to detect at least some of the non-hearing aids. So if they don't call themselves hearing aids, well, they're not hearing aids. They may use wordings that very, very similar to hearing aids. Personal amplification, personal amplifier, personal speech aids, whatever they word it, they are not allowed to use the word hearing aids. So what you're looking for, if you want to find FDA-regulated hearing aids, they need to literally say hearing aids. So that already excluded the 3 boxes on the right. They are personal amplification devices. They are hearables, and basically the Bluetooth headphone-like things that may have added feature that will help you, so they claim, to understand speech better. But these are not hearing aids. So those 3 boxes on the left are hearing aids. So there are these traditional hearing aids, what we used to call hearing aid. Now, after the availability of OTC devices, they're called prescription hearing aids. So those are the devices you need to see a professional audiologist to get fitted. And then there are these 2 orange boxes, 2 different kind of over-the-counter hearing aids. So there's one kind that it will work right out of box, has presets in them. So the device you put on, you rotate through you rotate through the presets and select one of the presets that's already in the device. There's no connecting to your phone. There's no connecting to a computer. It's just the device is standalone. So this is called preset OTC hearing aids. And then the box in the middle is called self-fitting OTC hearing aids. So those are the devices that will have the capability of fit to your own hearing, but that usually require connecting the hearing aid to your phone. There's an app in the phone will run you through a hearing test procedure, and then that will customize the device to your own hearing. So these devices are more precise, but that require connecting to the phone. Okay. The reason why we differentiate these 2 boxes is that the self-fitting hearing aids requires pre-market approval from FDA. What that means is that the manufacturer will need to run a clinical trial and indicate this is actually effective. However, the preset OTC hearing aid are considered exempt from pre-market approval. So for if we have pharmacy people here, this is called 510K exemption. So the preset hearing aid has less of check by FDA, so to speak. So I would say that self-fitting hearing aid may have better safeguard. So again, how do I know this is a over-the-counter hearing aid? How do I know this is self-fitting over-the-counter hearing? Well, to qualify as self-fitting OTC hearing aid, the box has to say literally, need to have the literal label saying self-fitting OTC hearing aids. That string of wording need to be exact. So, that here's the punchline. We're looking for this thing on the box. In terms of what the device look like, so there's different form factors. So there are these ones that sit in your ear canal and virtually invisible, that sit in there. There are these styles that look like Bluetooth headphones. So when you're wearing this device, people may just think that you're wearing a pair of headphones. And then there are these devices look exactly like a hearing aid. So this is the form factor if you plan on wearing hearing aids throughout the day for a longer period of time. This is more comfortable. Oh, sorry. This is more comfortable to be wearing throughout the day. And more recently, last year, AirPods qualify as self-fitting OTC hearing aids. So they got FDA approval. So AirPods are over-the-counter hearing aids. If you already have the new AirPods, all you have to do is to go through an Apple hearing test, and then you can fit the AirPods to your needs. Okay. Among these devices, we're talking about price point from $200 to $2,000, depending on the form factor and the sophistication of the fitting procedure and the amount of care the manufacturer provide. So, for example, just as an example, AirPods cost about $299. If you have membership with Costco, probably you get a discount for that. And this device from a year ago that sit inside the ear canal that is invisible, that is more towards $2,000. Those two kind of the bound, everything else kind of in between. Okay. $2,000 a pair. So this is when you get OTC hearing aid, usually you get a pair. Who may benefit from over-the-counter hearing aid? This all sounds good. How do I know whether this will help me? So am I a good candidate for over-the-counter, or should I see a professional to get prescription hearing aids? Over-the-counter hearing aids are intended for adults. They're not for children. This is the first thing. Second is that they're designed for people with mild to moderate degree of hearing loss. So there's a range of degree of hearing loss that this design is the best for. Then the question is, how do I know I have mild to moderate hearing loss? And if I'm not familiar with that jargon, how do I tell? So there's plenty of screener. For example, this one is a screener of 10 questions that you can easily fill out and sum up the score. So this particular questionnaire asks some real life scenarios like, does a hearing problem cause you to feel embarrassed when meeting new people, for example? And then the answer is yes, sometimes, no, each one attached to a different score. And then you sum up the score. So this will give you a guideline as to what you may benefit from the OTC hearing aids. So if you do realize you have more than moderate degree of hearing loss, then that points you to the need maybe to see an audiologist, right? So So the way we want to think about this is that the availability of OTC hearing aids is not put audiologists out of jobs, but funnel more people with audiologists at one end of the branch to offer complete care. So what these devices are not for, they are not for children, which we'll talk about, for more than moderate degree of hearing loss, not for asymmetric hearing loss, not for treatment of tinnitus or tinnitus. By the way, both pronunciation are both fine. So we say tinnitus, but if you prefer tinnitus, it's not wrong. So either way is good. So the one thing I do want to point out is that if you have sudden hearing loss, your hearing changes suddenly, that is not something you want to wait. So if you do feel one day you wake up, 1 year, you certain find there's imbalance between your 2 years of hearing, you need to see an ENT right away. Okay, so that's one thing I want to point out. So these things, these warning signs, are required by FDA to print on the label of over-the-counter hearing aids. So these hearing aids need to have a label just like any drugs, because these are medical devices with warnings. This is not for this. And when you have these number of red flag condition, you need to see an ENT rather than continue using this hearing aids. Let me just elaborate on the red flag conditions here. So these things need immediate medical attention rather than being addressed by hearing aids. Drainage, dizziness, sudden hearing loss, like what I was saying, asymmetric in hearing, and pain. So we also have some tools for people to check as to whether they need to see a hearing health professional. So we're coming. So the resources there are people like me. Have interest in you, everyone, not the manufacturer, not the professionals, not the insurance company. So I'm just list some resources for people to learn about more if they have access to internet, and there's these online resources. The first one is Hearing Tracker. Hearing Tracker is an online community run by hearing aid users themselves. So they have comprehensive review of all the hearing devices on the market, prescription or over-the-counter, comparing their price point, pros and cons, easiness of use, and taking care of. And then they also even have made the recording from each of the hearing aid. You can have a tryout on the internet. So this is your consumer report of hearing aids. So this is called Hearing Tracker. Okay, there's an online forum attached to this website where people are exchange their experiences and resources themselves. If you do not like online and virtual things, we have this association called Hearing Loss Association of America. They have different branches in different states. We have a Washington state of that. So this is the association of people with hearing loss. It's a nonprofit, so they advocate for for people with hearing loss themselves. They also have a comprehensive online resource about OTC devices as well. Okay, so if nothing else, the OTC, the emergence of OTC hearing aids open up more people come in and more tools for people to help and advocate for better hearing and auditory wellness. Okay, so the problem, I just gonna spend 1 minute on this. The problem of the current OTC market is, since when people are purchasing a hearing aid, they are not just looking for a device, but they're also looking for care. But currently, all the care are included as customer service of this device. And of course, some of the devices, the only thing that they have is the regular call center. And we kind of know that addressing a hearing aid problem on the phone with the call center, just does not work. So figuring out the path to deliver care, in particular in-person care, is something that we need to think about. Especially, people really appreciate some kind of in-person assurance of the device is set up okay. They got the phone connected and everything else. Yeah, like what I said, the in-person care is difficult because we don't know who these people should be. They should not be audiologists because there's not enough of them, right? They're expensive as well. So, so who should be paying, manufacturer or who else? So, what we've been doing, and what's going to happen in 2 weeks' time, is we run an academic training program together with delivering information about OTC hearing aids to the communities in person, but in a high throughput event kind of style. So we have the advantage of, as academic institution, we have access to our students, we have access to interprofessional training, not just hearing people. We have expertise with pharmacy, with other social work and nursing. So we usually already have established community connection or community-based research programs. So we have these resources. What we want to do, what we've been doing, is going out to the community and set up tables instead of this kind of event, which is a professor stand up and talk for an hour. I apologize for that. So we divide up into tables, and we can get hearing screening done for a lot of people right there and then. We can bring hearing aids to the event. People can try them on. So nothing will give you more confidence than you have seen it. You know how to charge it. You know you touch it. You know you can, take care of this device. And it's kind of, now that I've been doing this for a while, it's kind of insane to ask someone to commit $2,000 before they even seen the thing, right? Yeah. So that's what's up. So we've been to, and this next in 2 weeks' time will not be our first rodeo. We've been on a variety of facilities, from community centers to nursing facilities and to retirement homes. Yeah. So so we've been to places. Issaquah and Tacoma and so on and so forth. So I'd like to just conclude there and basically saying that I appreciate the opportunity to come out here and meet you, and this is one small step from our professions to go out and deliver information and care to everyone. Yeah, that's us. Thank you.
Time for questions. Okay. Yes. Would you be over on this side? Not on the other side.
There's another one here.
It's on. Just put it up to your mouth.
Is this on?
Yes.
Yeah, it's on. A recent article in the New Yorker is titled Subtitling Your Life, and it's about the glasses that you wear. And there's a, just like you see there, there's a caption that runs across the bottom of the glasses, and there's at least a couple of outfits that produce these. And anyway, it's very well written, and it looked good. I have probably more than moderate hearing loss, and I was interested in this, and wonder if you had any comments.
Yeah, absolutely. So we had a colleague, I'd say 5-6 years ago, started doing the research of basically have live captions in glasses. And what we learned is that, I don't know whether these manufacturer of these glasses knows, is that for people who are older and need time to process information, and especially for people who live with hearing loss for some time, they are lip readers. They need to stare at the lips. And having captions require them to divide attention between lips and the caption. And that is potentially taxing for amount of work. And also this related to the pace of the talker as well. So if the talker is aware of this device generating a live caption and be able to pace for it, this caption could work pretty well. However, in many cases that the talker is just rambling on and the caption is trying to catch up, sometimes not out of sync with the speech itself, that could create problems.
This was simultaneous, the transmission.
Yeah, so the caption you're seeing here, imagine that you wear a glass and the glass will project it. Yeah.
Simultaneous.
Yeah.
And I assume it means that this was very positive review, and I would infer that this was so effective, judged by the article, that you would get out of lip reading, or you would do it use the most effective source, which would be the transcription. But anyway.
Yeah, for some people. So the reading is not the easiest thing for many people. Reading fast is not the easiest thing either. And also these projected words require acute vision as well. And also reading, imagine that you're reading the caption from the conversation partner when they are trying to have a meaningful connection with you, and they're seeing your eyes are going left to right. So it created a little a new norm, let's put it this way, of social connectivity, which we do not know that how that's going to play out. But what we do know is that dividing attention across multiple modalities, hearing, lip reading, and caption reading, which is different from lip reading, could actually pose, load to the cognition. Yeah.
I have a question here.
Yeah.
Why does one need to be 18 or older? Why can't children have these?
Oh, yeah, so that's a very good question. So for children, the cause of hearing loss typically is much more, there's much more variety of causes. And a lot of time it's caused because they play in the dirt, So the middle ear infection is a more common issue among children, school-age children or younger. So, and that is a very different cause compared to age-related hearing loss, which is more in the cochlea, in the inner ear level. And if we are, and the majority of people with age-related hearing loss has almost similar trajectory and profile of hearing, so they could be addressed in a uniform, like OTC devices is designed with a limited flexibility but can address the most population. That's what this is designed for, versus for children you need a lot of customization of devices. Yeah, so then that require professional fitting and care. Yeah.
Other questions?
There's
Maybe it's too soon to know because it's only been since 2022. But if you transition to more severe hearing loss, how does that work? You've had the OTCs, and then you have to go to something more serious. Is there anything to say about that?
Yes. So this is a very good point. The reason why we have this OTC hearing aid, that one of the intents is to have people start trying out these hearing aid earlier, without waiting till their hearing loss gets so severe. When the hearing gets so severe, when you go to see an audiologist, at that point there's a very narrow range the audiologists have to work with. The reason being that since you've been living with hearing loss untreated for longer time, the brain is already adjusted to this narrowed input. So to open that up is a very tough task, even with the very capable, very premium priced devices. So it's much better transition if people already been a hearing aid user, OTC user or so, and when the hearing loss entering into a more severe stage, your brain is ready for hearing aids with more capability of amplifying sounds. So that will give audiologists and hearing healthcare professionals more room to work with. Yeah.
How is spatial localization affected by OTCs?
That's a very good question as well. So when you are wearing any devices at all, including earphones or any other thing, you change the shape of your outer ear. So the sound that the cues that we rely on in localizing sound are tied to the difference between the sound received at the two ears. When you change how sound get into the two ears, you modify the pass. So so as soon as you are wearing a device, you have some reduction of your capability of localizing sound. However, what most of the OTC devices and prescription devices nowadays, assuming that you don't have very severe hearing loss, they will fit you with this dome, we call dome, but they're ear tips, how the hearing aid coupled to your ear canal. They will fit this tip in a style that is open fit. So the tip will have holes in them, basically. So those holes where ventilation on the tip will help with the ventilation, will help with clearing out wax and all that. But also one advantage is it will preserve some of the cues important for localization. So it's safer to wear and more comfortable to wear. So those are actually, so if I just go to show you that device again. So you see, for example, this device sit deep in the ear canal, but you see how it couples, it has holes. It does not occlude the ear canal. So the sound that still can go through into your ear canal, the natural sound, will still be able to go through. So those natural sound will be providing those cues for spatial awareness. So you can see this device. Also, the coupler has holes on the. I don't know. It's not easy to see, but those domes are designed to be comfortable and leaving spatial awareness.
I have a question. Me. Yeah, I'll go back over it. Both my parents had hearing problems. And, first, of course, I watched the denial, like, the putting it off. And they were losing their hearing long enough ago that really it was just barely sophisticated small megaphones. I mean, what they can do now is so much more. But anyway, I remember thinking, I am not going to torture my family if I get hearing loss like they did. because they were always like, what, you know, and you couldn't holler to the next room, and, you know, if you weren't like and it just drove me nuts. But they didn't have many options. But anyway, so I basically been wearing bilateral hearing aids since I was 55. So I did not wait. And even then, I probably waited too long. Is there a genetic factor in addition to some of those others? I didn't see genetics on there.
No, but I just had a lunch with, so at University of Washington, we're actually one of the top institution on this genetics. And if you know anything about hearing, at one point in time, there's a big hope of regenerating hair cells, the sensory cells in the inner ear that may, reverse hearing loss. So we're actually one of the top institutions. So the person who used to head that institution, we just had lunch today, actually. So we had this conversation about the genetic basis of age-related hearing loss. And so what happened is that, so hearing is a very particular high energy consuming organ in your body. So it requires a particular battery. Basically, there's a space in your inner ear that has this mechanism that keep pumping positive charge potassium in it to maintain a battery. And that piece, that part of the proportion of the inner ear or the cochlea has maybe the highest concentration of mitochondria in your body, because it takes so much work to get all the to maintain the voltage of this battery, so to speak. So one mechanism underlying age-related hearing loss is because then over time these mitochondria are not as efficient, so then your battery start to drop in voltage. So then that's one of the causes. And guess what cause damage of these tissues and mitochondria and other. So the byproducts come out of mitochondria. They oxidate the tissue around. So you may have seen advertisement for antioxidant, this and that, or whatever. So there's some basis for that. That is, the cause of aging process in the auditory system is nothing different from other aging processes in our body. Hence the comorbidities, right? So that we're seeing. So that's one of the potential reasons underlying age-related hearing loss, if you care about the nerdy science. Yeah. Yeah, it's right there.
Now, I'm intrigued with that last comment. Is there nutritional or vitamin supplements that you can take that will recharge your batteries?
People have done big studies on trying to pin down the things you could do to prevent age-related hearing loss, or all the risk factors and things. After years of study, guess what they found? Eating healthy, exercise. So all the things is good for you. It would be good for your hearing.
Yep.
But in particular, one factor is about carb, low carb diet. So low carb diet would be helpful for maintaining hearing longer. Yeah.
Terrific, thank you.
There's one more.
Thank you. Are these manufactured in China? Should we hurry up and get them?
So it is. Let's put it this way. There's a weirdness in this country. There's weirdness in that country as well. So there's a boom in hearing aid in China right now. There's many manufacturers start to put out hearing aids. There used to be consumer electronic companies. It's pretty easy for them to spin their product into a hearing aid. The reason why there's a boom in China is because the government put in a lot of resources into chips. You probably know the story. And then hearing aid require special chips. So then all these small business can write a grant from their government saying that we're doing chip stuff and to get money from their governments, if you know what I mean. So like what I said, there's awareness here, there's awareness there. So yeah.
We know the weirdness. Okay. When I thought it was interesting if you came to the talk last night about how important it is for us to be social as we age, and that makes a big difference. And that's one of the things you were talking to me about as we walked down here, that having hearing loss often prevents you from getting together with people and being social and sharing. And so what he was talking about with hearing loss and the consequences sounded so much like the talk last night about doing this. And in our work here at Horizon House, we know that some people have struggled with their hearing aids because wearing the mask flips them out, or the people have trouble. So some people say to me, well, I've had hearing aids, but for the last 3 years I haven't used them. And I hope from listening to this that you say, wait, I have a right to ask my audiologist to help me get hearing aids that fit my ear and work for me, or to come when your students come and try out some of these OTC devices. But what you don't want to do is to not use a hearing device if you're starting to lose your hearing. It'll make a big difference in the quality of your life and then the quality of our lives, because we won't be able to pick your brains anymore. So I just want to encourage you to really take advantage of these opportunities. So Jess is ready to take signups for people who want to come and meet with with you and your students when they come. I put the paper down there, so I can't remember the date now. Do you remember? The 19th. But I encourage you to do that, to sign up if you're interested and reserve a spot. Is there another question that someone has? Okay.
About the expense of prescribed hearing aids. A number of people have been going down to Costco and finding that much cheaper than going to the audiologist. For me, it would be Kaiser or other places. Are there problems with quality, and are they over-the-counter things, or are they really prescribed things?
No. So Costco can make things cheaper, which we know. But the hearing aids, they must be doing something good about their hearing services. We have heard a lot of good things about Costco and the service you get from them. So one the data we learned is that a typical you can have actually the state require every hearing aid to have a penalty-free return policy. So yeah. So there's certain, it may vary, but they are required to have this return policy. What happened with a lot of over-the-counter hearing aids, especially when they do not provide the care, is that people purchase them, connect to their phone, then return it, right? Haven't even put it on their ear. So we're looking at, for many of these devices, we're talking about 50% of return rate currently. For Costco, we know their return rate is super low. It's impressively low. It is jaw-droppingly low. They must have done something good, because we know we have students, we have patients got their hearing aid from Costco, and they always say good things. So I couldn't say bad things about them. Okay. Yeah, it could be. Yeah, you have to go there anyway, and then that's good use of your time.
She said they clean them while you shop. So we've heard good things from our residents, too, about Costco. And what happened when the over-the-counter devices went up for sale, places like Kaiser copay really dropped significantly. So the cost of the audiologist provided hearing aids has gone down significantly in the last 2 years because of these over-the-counter devices being available. Have you seen that too?
If nothing else, having these professional work harder and reach out to you, create a more competitive, I think that's a good, healthy thing.
So people from here have gone like to Virginia Mason's hearing clinic, or to Joe Munson here at Horizon House, or to Kaiser, and gotten a prescription from them, but taken it to Costco. And then, as you say, they've really said the service, and they're selling the same hearing aids as these places sell. They're not different hearing devices.
And also, I believe, based on what I've heard, the very good students of ours work at Costco. So, meaning that they actually treat their employees okay. Otherwise, they could have work anywhere. So
we're not trying to sell something, but we're just trying to be honest about what we've heard.
Yeah. So this is just the honest feedback I've heard. Yeah.
So thank you again for coming. Thank you for your student for coming with you. We appreciate it. We look forward to seeing you.